Hello and welcome to another organ removal video. 8 months ago, at the tender age of just 25 years old, I had my uterus removed in a procedure called a hysterectomy. I compiled everything I learned that factored into my decision-making process and my personal experience and reasons for getting my uterus removed into this handy-dandy video. We will be covering some of the basic ins and outs of hysterectomies, like what a hysterectomy is and isn't, risks, surgery types, and more, to my own personal motivations for getting my uterus removed and actual experience of surgery and recovery. Approximately 400,000 people in the USA alone get hysterectomies every year, so even if you yourself aren't planning on having one, it is highly likely that someone you know has had or will have one, so stick around and learn something interesting and important. I'm intending for this to be the video that I wish that I had had when I was starting the process of learning about hysterectomies, which is a blend of basic medical information and first-hand personal experience. However,
I am not a doctor or any kind of medical professional, and none of this is medical advice. This video is for entertainment and educational purposes only. Always do your own research and talk to your healthcare provider.
as always, drop any questions or thoughts in the comment section down below. Resources will be linked in the description. First things first. I had my uterus removed due to heavy and painful menstruation, and I did not have any additional complications like fibroids, PCOS, endometriosis, adenomyosis, or cancer, so that is the perspective that I am coming from in this video. I will share more about my motivations and how I made it happen a little bit later in the video. We're gonna start with the basics, because when it comes to female anatomy, we should never assume that anybody knows anything, including me when I started this process 6 years ago. Okay, so a hysterectomy is the removal of the uterus and only the uterus. The uterus is the womb where a hypothetical fetus would grow and also the source of menstruation. There are several other closely related organs, including the ovaries, which is where eggs and hormones come from, and the uterine tubes, which is how the eggs get into the uterus from the ovaries. Don't worry, I am not forgetting about the cervix, we will get there shortly. A hysterectomy does not automatically include removal of the ovaries and fallopian tubes, but they are often done in conjunction with each other in the same surgery, depending on the needs of the person having the surgery. Having the tubes removed is called a salpingectomy, and having the ovaries removed is called an oophorectomy. Oftentimes you'll see these terms with the word bilateral in front of them, which just means they're taking out both of them. Bilateral means both sides. For example, when I got sterilized when I was 22, I had a bilateral salpingectomy, in which they removed both of my uterine tubes. Check that video out somewhere up here. If you are premenopausal and you have your ovaries removed, you will go through menopause. To prevent this, you typically go on some kind of hormone replacement therapy to replace the hormones that your missing ovaries are no longer producing in your body, since those hormones are important to your health. This brings me to the most common question I've gotten since having a hysterectomy, which is if I am on some kind of hormone replacement therapy, because lots of people think that getting your uterus removed also means getting your ovaries removed, or that it somehow alters your hormones. I still have ovaries. People who only have their uteruses removed are hormonally unchanged, because the thing that makes the hormones, the ovaries, are still there. I do get why this is a point of confusion though, because hysterectomies have typically been done on people who have significant medical issues with their reproductive organs that often aren't limited to just the uterus and can necessitate the removal of multiple organs in one sitting. Cancer or endometriosis are examples. So it's not uncommon that people get these procedures done at the same time, but they are in fact separate and one does not entail the other. If you're a young person pre-menopause with no medical need to remove the ovaries, it is highly recommended that you keep them. That being said, there are cases where people who are seeking a hysterectomy for gender-affirming purposes are comfortable committing to some form of hormone replacement therapy indefinitely, and sometimes do have their ovaries removed in addition to having their uterus removed, despite being young, but some also opt for keeping the ovaries to not be hormone medication dependent for the rest of their lives. Regarding the tubes, it is apparently quite common to do a hysterectomy with opportunistic salpingectomy, which just means that while they're already in there, they're going to take the uterine tubes too, since it's been found that ovarian cancer often actually starts in the tubes, and if you don't have a uterus, you really don't need the tubes. They don't have any function other than transporting eggs into the uterus, and without a uterus, you might as well reduce your cancer risk. When they combine all three of these procedures, it is called a hysterectomy with salpingo-oophorectomy. I'm emphasizing this so much because I honestly believe that some of the health concerns that people have with hysterectomies are actually just health concerns about having your ovaries removed. So if people realize that they were separate, they may be more open to having a hysterectomy to solve some of their health problems. Also, this should go without saying, but just in case, if you get a hysterectomy, you completely lose the ability to get pregnant, which is a huge plus in my opinion, but I know that that isn't the case for everybody. It is technically a form of sterilization, as you can definitely no longer get pregnant after you have your uterus removed. However, since bilateral salpingectomies are much less invasive and have fewer potential long-term risks, hysterectomies are not typically done as a sterilization procedure, and sterilization may just be an added benefit if that's something that you happen to also be seeking in addition to whatever primary issue you're addressing with the hysterectomy. Heavy and painful menstrual bleeding, for example. All right, on to the cervix. To keep or to cuff. If you've ever looked into getting a hysterectomy, it is very likely that you have stumbled upon the mountains of discourse regarding keeping or removing your cervix during a hysterectomy. I personally literally agonized for months and lost actual sleep prior to making this decision for myself. All right, real quick, what even is the cervix? The cervix is the name for the bottom part of the uterus. People sometimes talk about it like it's a separate organ, but it's actually just the skinnier neck-like part of the uterus. Fun fact, the word cervix is just the Latin word for neck, apparently, and can refer to both the neck of the uterus or your other neck, which supports your head, which is also known as the cervical spine. You can kind of think of the cervix as a sphincter that opens up into the vaginal canal. It's essentially a gateway between the vaginal canal, or the outside world, and the uterus. It's not technically a sphincter actually, but it does open and close to allow things in and out, although I think it's really just designed to let stuff out. The only thing that's like supposed to go in through it is sperm, and I don't think it has to dilate to let that through. I think it's small enough to just fit, but don't quote me on that. But it definitely does have to dilate or open up to let out menstrual blood and endometrial tissue during menstruation, and of course also babies during childbirth. If you choose to keep the cervix, the uterus is technically only partially removed, and the part that is left is called the cervical stump. This is where the language of partial versus total hysterectomy comes from, which, at least according to my doctor, is outdated, and she prefers to call it a supracervical hysterectomy, meaning above the cervix if the cervix is being kept, and I guess just call it a hysterectomy if the full uterus, including the cervix, is removed. But the language of partial versus total is used pretty often still, so just to cover that even more thoroughly, partial refers to a hysterectomy in which the cervix or bottom of the uterus is not removed, since the uterus is only partially removed, and a total refers to the full uterus removal, including cervix. Sometimes the word radical is also thrown around, as in radical hysterectomy, which is, according to my research, kind of an unspecific term for a hysterectomy that includes the removal of the cervix and also the fallopian tubes, and sometimes also the ovaries and or nearby lymph nodes and ligaments. So I guess just check with your doctor what exactly they mean by it if that's something that you are talking about with them. It's typically done to treat cancer, from what I read. When they do opt to remove the cervix, they kind of fold over the top of the vagina, like what's left of the vaginal canal, and seal it with stitches. Basically, imagine sewing up the end of a tube sock. This is called a vaginal cuff in the United States of America, and apparently a vaginal vault in the UK, which sounds a lot more mysterious. If you go on any online forums where people are discussing their impending hysterectomies, you are very likely to stumble upon many threads of people extensively discussing the pros and cons to cervix removal. People, including me, as I mentioned earlier, really agonize over this decision, and I don't blame them. The research doesn't really come out strongly in favor of either choice. There are pros and cons to both choices. It seems like most doctors these days recommend removing the cervix, since it doesn't really have much of a function post-hysterectomy, and it's also where cervical cancer develops, which is a pretty deadly form of cancer. So the logic is that if you don't need it and it's just kind of sitting there waiting to develop a deadly form of cancer, you might as well take it out. This is super reasonable, especially if you're at a higher risk for HPV or cervical cancer, and I read that some people don't need to go back for pap smears or cervical cancer screenings anymore if they get it removed, but from others I've also read that they have the cuffs swabbed since some cervical cells can still sort of be lingering in the area. Another reason people opt to remove the cervix is that since it's part of the uterus, it still has some endometrial lining, which means there is a very, very, very small chance you may still have some menstrual bleeding if your surgeon isn't able to like fully remove all of the lining. My doctor said in her entire career, she'd only ever seen one patient who had any kind of menstrual bleeding that was more than just like a tiny bit of light brown spotting post supracervical hysterectomy, and it wasn't even a surgery she performed. Apparently, the previous doctor had just not done a great job, and a lot of the uterus was still in there when she went back to like correct the situation. Since it is uterine tissue, in some cases, the cervix can also still develop fibroids post-uterus removal. So I've heard people's doctor recommend cervical removal if you do have a history of fibroids. Now that we've covered the pros to removing it, I'll go ahead and reveal that I actually kept mine, for reasons that I will now get into. So, one of the pros of keeping the cervix is that it is a slightly less invasive procedure due to the fact that you are leaving things more intact. This also means that the recovery and healing time is often shorter for people who keep their cervixes. I've always been somebody with a semi-overactive bladder, and my doctor mentioned that there is some evidence to suggest that there are nerve connections shared between the cervical area and the bladder. The cervix may also play a small role in like physically supporting the bladder in the sense that they like literally touch. And I wanted to cause the smallest amount of disruption to my pelvic organs as possible, largely just to avoid messing up my bladder and risking feeling like I need to pee all the time or something worse. My doctor is very smart and capable, so that's the best I have regarding that topic. Keeping your cervix also obviously means that you won't have the vaginal cuff that I mentioned earlier. And frankly, the idea of having a vaginal cuff just really freaked me out. And this is in no way to make anybody who has a cuff or who is going to get one feel like it's a bad thing to get or to have. It's just that every time I imagined having a vaginal cuff, I would start to feel faint and lightheaded and lose feeling in my fingers. It's even happening right now. I also learned about something that can happen called a cuff tear, which is when the stitches holding the cuff together at the top fail and it opens up again. This is not common, but still the possibility just seemed really, really unappealing to me. Since I'm not at any particular risk for cervical cancer, combined with the sensitive bladder thing, and my intensely negative reaction to the cuff, my doctor agreed that while she usually removes them, I was a good candidate for actually retaining my cervix. Another quick note here is that if something does end up happening with your cervix in the future, they can always just do another surgery to remove it, which is obviously not preferred, but it's not like if you keep it and you have issues with it down the road, you're stuck with that forever. I also didn't actually have to tell her my decision until the day of the surgery, and ultimately I'm so glad I made the choice that I did. Earlier, I mentioned that if you do keep your cervix, there is a small chance that you may have a tiny bit of menstrual bleeding. Well, I'm happy to report that while I am one of the unlucky few who do in fact experience a hint of menstruation, it is literally almost nothing and it is extremely unbothersome. And if I consider it unbothersome, you can rest assured it truly is. In fact, there's actually an unexpected upside in the fact that it allows me to at least loosely track the hormonal cycle that is still happening inside of my body, which is kind of neat. Now we're going to talk about surgery types. There are several ways in which a uterus can be removed from a person, and the best method for you will depend on your needs and what your doctor is capable of and comfortable with. The first option is fully abdominally, in which they literally cut your abdomen open with one big cut, either vertically or horizontally, opposite, and remove things that way. This is also known as open surgery. This is sometimes required for people whose uteruses have become enlarged or have other things to remove, oftentimes due to fibroids or cancer. This is the most invasive method, and due to the larger incision, it often has a longer associated healing and recovery time. Next, we have the laparoscopic method, in which they make several small incisions, about 1 to 3 centimeters, through which they can insert cameras and tools to do the surgery. There is also a version of the laparoscopic surgery that is robotically assisted, in which the surgeon operates via a highly precise surgical robot that puts its arms through those little incisions I mentioned earlier. Yes, this is the grape peeling robot.
Yes, we did in fact do surgery on a grape.
Once amputated, the uterus can be removed through an additional, slightly larger abdominal incision or through the vaginal canal. When they remove the uterus through the vagina, it is called a vaginal hysterectomy. The uterus can be removed vaginally if it is not too enlarged, either through the hole that is created when the cervix is severed, or through an incision at the back of the vaginal canal, kind of behind the cervix. This second method is less common, I believe, and only works if the uterus is quite small or on the smaller side. However, the uterus can also be cut up into smaller pieces while still in the body to allow for easier removal, which is called morcellation. I've also heard of versions of the surgery in which they're done via one single incision through the belly button, and even some that are done entirely vaginally with no abdominal incisions at all, but it seems like these methods are much less common than the first two. Essentially, the number of incisions and their size can vary pretty significantly. I won't put any pictures here, but if it's something that you're curious about, you can just Google hysterectomy scars and you will see quite a variety. I honestly had a bit of a crisis about ending up covered in scars, and during my initial conversation with my doctor, she said that the method that she uses requires 4 to 5 1-inch long incisions, potentially plus one slightly wider one through which to remove the uterus, which frankly freaked me out. And ultimately, I agreed to it because I needed the surgery. Luckily, though, it turned out that due to how small my uterus was, she was able to use a combination of the methods in which she was able to remove my uterus through a vaginal incision just behind the cervix during a robotically assisted laparoscopic procedure. This means that the cervix is still intact, but I also don't have the larger abdominal incision through which the uterus was removed because she was able to get it out through like a vaginal incision. Altogether, she made 4 abdominal incisions, 3 of which are visible and about 1 centimeter long, and the 4th of which is invisible because it is in my belly button and tiny. Here, I'll show you what it looks like since it would have helped me a lot to have seen how minimally this can be done. See? Truly not a big deal. Down here, she even went through one of my old scars from the sterilization surgery, and the other one has faded so completely it is hardly visible, so I assume the new ones will fade similarly. Putting it all together, I had a robotically assisted, laparoscopic, supracervical hysterectomy. There are other variations of how hysterectomy can be done, and a whole lot more nuance than I will ever be able to learn or fit into a video, but those seem to be the main ones. And if you have had a different kind of hysterectomy, please share in the comments if you are comfortable doing so. Getting a hysterectomy, like any other surgery, comes with risks. There are the immediate risks that come with surgery, like having nearby organs nicked or damaged by the sharp tools, infections of the incisions, the risks that come with anesthesia, and so on and so forth. There are also long-term risks that come from uterus removal. For example, prolapse. Pelvic organ prolapse is basically when your pelvic organs, like your intestines, bladder, rectum, uterus, vagina, etc., prolapse, or fall down, essentially, due to not being properly supported by the surrounding muscles or having too much pressure put on them over time. Pelvic organ prolapse can happen to pretty much anybody, but it is more common for people with female bodies due to the muscular structure of the pelvis. Prolapse can also happen to people who undergo pregnancy and childbirth, and even people who have never had a hysterectomy, nor a pregnancy, nor experienced childbirth, so it is absolutely not something that is exclusive to people who have had hysterectomies. Other risk factors also include obesity and simply aging. My doctor explained that in my case, since I am not overweight and have never been pregnant or given birth, my risk for prolapse is very, very low, even now, post-hysterectomy. Another potential side effect is change in sexual function. For example, some people experience orgasms differently post-hysterectomy. Some of the sensation people experience during an orgasm can be from uterine contractions, so no more uterus means no more uterus contractions. Additionally, some people may have sensation in their cervix during sexual activity, and with no more cervix, that will also obviously no longer be happening. I've even heard that some people will say that the place where they feel a sensation sort of just moved from one region to another. The reality is that the majority of people don't report significant changes in sexual function post-hysterectomy, regardless of whether or not the cervix is removed. There are, though, some cases in which people report significant improvements because the health issues that were causing them to seek a hysterectomy in the first place were also causing pain or issues with sexual activity, so solving the root of those issues also improved their sexual function. There are, of course, the anecdotes about people reporting a complete disruption of their ability to experience sexual pleasure, but if and how that is connected to the hysterectomy is not clear, so take those with a grain of salt. Again, we have to be sure to differentiate between a hysterectomy and an oophorectomy, because having your ovaries removed may have an impact on your libido due to the fact that hormones are not being produced anymore. But a hysterectomy alone should not cause these issues. That being said, another potential side effect of having a hysterectomy is ovarian shutdown. This is exactly what it sounds like. Due to some kind of trauma or disruption to the area during surgery, sometimes people's ovaries shut down and stop working either immediately after the surgery or sometime months, weeks, or years after the surgery. This is not very common, but it does happen to some people and is a very serious consequence. Some studies also suggest that there is a risk of experiencing menopause a few years earlier if you've had a hysterectomy, but this is pretty poorly studied. What is more common is that people experience a temporary hormonal disruption in the weeks or months following the hysterectomy, but they have a full recover after their bodies settle. I can personally report that I had 2 nights in the week following the hysterectomy where I woke up at like 5 or 6 in the morning, like so hot, but that only happened twice and then everything went back to normal. There can also be the risk of regret of not personally experiencing pregnancy or childbirth, either at all or ever again, depending on if you've birthed children or not. Ultimately, while it is a major surgery that involves organ removal, hysterectomies are a routine, common, and generally safe surgery that like 400,000 people get in the United States of America alone every year. I'd also like to point out that the majority of data about hysterectomies comes from people who have significant health problems with their reproductive organs, typically in their 40s, 50s, and older. Typically, hysterectomies were not performed on young people or at all unless they were considered highly medically necessary because of the taboo surrounding female sterility. A woman's fertility was to be preserved as long as possible in case she wanted children or she met a man who wanted to use her body to make children. Many doctors still don't entertain the idea of performing hysterectomies for anything other than immediately life-threatening conditions, especially for people without children because of how strongly they may believe that women should have children or believe that they one day may want that. Women's pain and health issues also tend to not be taken as seriously as they should be, so having an organ removed may be considered a disproportionate treatment by some doctors to female pain, which needs to change. For those reasons and more, we don't have much data regarding the long-term health outcomes for young, largely healthy people who have their uteruses removed. It seems very possible that people who have already had problems with their reproductive organs could continue to have other problems with their reproductive organs unrelated to the hysterectomy. It follows that somebody like me, who had their uterus removed for heavy and painful menstruation, may not have the same long-term risks and complications as somebody who, say, had endometriosis for 30 years, had 2 children, and then had their uterus removed once it was the size of a football because it was riddled with fibroids and endometrial adhesions had glued their ovaries to their intestines. I just made that up, but I'm sure it's probably happened and you get the point. Additionally, younger people also just tend to heal better. And if you have your cervix and fallopian tubes removed, you're actually lowering your risk of the associated types of cancer. Not to mention, a lot of the conversation around hysterectomies often doesn't clearly distinguish between a pure hysterectomy and hysterectomy with ovary removal, which has massive implications on long-term health outcomes. As I mentioned earlier, I had a pretty uninvasive, robotically assisted, laparoscopic supracervical hysterectomy around 7 months ago at the age of 25. So, why did I put myself through all of this? First, we're gonna have a quick crash course on periods, aka menstruation, because this is extremely important. There is a lining in the uterus called the endometrial lining, which is the nutritious tissue that the fertilized egg theoretically implants in. Over the course of the menstrual cycle, it thickens, and then if nothing is implanted, aka you don't get pregnant, it sheds to start anew. When it sheds, this is called menstruation or a period, the lining literally rips itself from the inside of the uterus, which creates a wound all over the internal surface area of the uterus, just like if you were to accidentally peel your arm with like an apple peeler, which is why it bleeds. And it's not just endometrial tissue that leaves the body during menstruation, it's also actual blood from an actual wound. I already mentioned earlier that I experienced disruptively heavy and painful menstruation. I knew from the first moment I ever experienced, nay, heard about menstruation at the age of 12 that this was not for me. There was no way that I was going to spend 40-ish years of my life bleeding and in pain for 5 to 7 out of every 30 days. Are you kidding me? What kind of cursed deal is that supposed to be? I have very vivid memories of being shook by this information and just being enraged at how unjust this felt. From the very beginning, I'd experienced heavy and severe blood loss and extreme cramping during menstruation, to the degree that I was like, there's no other word for it, just like literally disabled by it, and also suffered from anemia for years. Like, I'm serious. There was just so much blood and pain that there was no way for me to be a normal, happy, healthy person. The time between periods was pretty much always spent recovering from the last one and then dreading the next one. But I also want to mention that I never got to the point of like throwing up or passing out from the pain, which I know is unfortunately something that happens to people. So while I'd say I was definitely suffering, I never reached those levels. I also never had periods that went on for like weeks or months or anything like that. But anyways, when I was 14, I learned that one of my friends was using hormonal birth control to lighten her periods, and I immediately knew that I needed to get on that. From there started my long and arduous journey about learning about how to control menstruation. However, it wasn't until I was 16 that I learned that taking birth control continuously, without taking the placebo pill for a week-long break, could allow you to skip periods entirely, which is completely safe and super underrated. I avoided periods for many years using this method with varying degrees of success, first using the pill, then the patch, then I tried 2 IUDs, which caused me the worst pain of my entire life. Maybe one day I'll make an IUD video. Then I used a NuvaRing for a while, and then after that, I had my tubes removed, and I went a full year with no menstrual suppression to see if in the past 8 years things had gotten better. Spoiler alert, they did not. That year was so bad. During which I actually discovered a medication called tranexamic acid. It is used to control bleeding in people with bleeding disorders and in people who experience heavy menstrual bleeding, which actually reduced the bleeding by around 70% in the best case scenario for me, but it didn't address the cramping and required an extremely strict routine of taking 2 gigantic pills every 8 hours on the dot for 6 days straight every month. Then I tried an IUD for the 3rd time. I got twilight anesthesia for this one, but it still caused me like an unbelievable amount of pain pretty much constantly until I had it removed 7 months later. After that, I had an endometrial ablation. This is a procedure that uses like heat or another kind of controlled destructive force to destroy the endometrial lining of the uterus that we talked about earlier to prevent it from shedding and bleeding during menstruation. The ablation did not work because I was too young and my body was too good at healing, which is very common for people under the age of 35. Yay! At this point, I was so sick and tired of being on hormonal birth control for various reasons that I decided to try to be really good at taking the tranexamic acid just to reduce the bleeding, which ultimately didn't work well enough. I was still bleeding heavily enough and experiencing so much pain that I could not be a functioning human being for at least 5 days out of every 30. Not to mention the anemia was making a comeback. It was just no way to live. I also want to be extremely clear here. I am pro hormonal birth control. It allowed me to live at least somewhat normally for many years of my life, and it also helps so many people avoid pregnancy and manage other health issues. We can recognize the flaws in the available options and demand better ones without demonizing it. It is an amazing and relatively safe option for millions of people, and just because it ended up not being right for me in the long term doesn't mean that it can't be for other people. Back on track. I have no idea when or how I learned what a hysterectomy is, but when I asked my first gynecologist about it, I think when I was around, I don't know, like 18, she literally laughed at me and told me that no doctor would ever take a uterus out of a young and healthy person who had never had kids like me. So, Fueled by the rage of being betrayed by both this paternalistic doctor and my own body, I doubled down on my research until I found my next doctor on the child-free subreddit's child-free friendly doctors list, which is in the description of this video. She had been listed by a previous patient/Reddit user as having performed sterilization surgeries on people who were young and hadn't previously had children, so I figured she'd be a good candidate. And during our first consultation, when I was 22, she actually agreed to give me a hysterectomy based on the fact that I had experienced adverse effects from heavy and painful menstruation that impacted my ability to live a normal life. Unfortunately, my insurance denied it. Yes, it was United Healthcare, but instead she ended up tying my tubes and doing an exploratory diagnostic laparoscopic surgery, both of which we hoped might convince my insurance in a future attempt at a hysterectomy. It was after this that I tried some of the stuff that I mentioned earlier, like the tranexamic acid, the ablation, the third IUD, and then going back on the pill for a bit. It was also during this time that I learned that heavy menstrual bleeding can be caused by a bleeding disorder, which is how I learned about the tranexamic acid. Just know I tried pretty much everything to manage menstruation short of having the actual uterus removed. Okay, I did actually refuse the medication that puts you into early menopause that I think the insurance tries to push on you as like a troubleshooting method, which was an absolutely gigantic no thank you to that one, which my doctor ended up being very much in support of. Trying to solve this biological puzzle was basically a part-time job for over 10 years. I attempted all of these things because ultimately I wanted to see if there was something I could do that wasn't a major surgery. Even though I know now that I'm not at high risk of having these negative side effects, there is a long list of things that can and do go wrong. And the fact that it's irreversible, and I might have been stuck on a hormone therapy in my early 20s due to ovarian shutdown, or might eventually need an additional surgery due to prolapse or a cuff tear, or any other number of complications, was scary and unappealing. I did not take it lightly. But at the beginning of 2024, after attempting to manage the situation with tranexamic acid and copious amounts of over-the-counter pain medication, I had just become this strange shell of a person who had to live her life at the whims of her body, and I hated it. Another important piece of information here is I've never wanted children, and I've always especially detested the idea of being pregnant. I knew it was absolutely never in the cards for me, and that also made it a lot less complicated for me to decide to get rid of my uterus. Also, to me, there's nothing beautiful or desirable about menstruation. To me, it was just this symbol of being oppressed by my own body, this biological function that was not at all to my personal benefit, but actually to my significant personal detriment. By the way, the vast majority of other species of mammals just reabsorb the endometrial lining with no shedding or bleeding, so enjoy living with that piece of information. I was also becoming deeply resentful of the fact that I and so many people like me have been neglected by the medical community, and that the only options presented to me were suffer immensely while having to pretend to live a completely normal life, take this hormonal birth control for 30 more years that is likely causing other medical issue and could also be changing my personality and experience of life, also tying me to a doctor and pharmacy forever, or undergo a significant permanent surgery that has many potential life-altering side effects and risks. Ultimately, the hysterectomy ended up being the best option for me, and I'm so glad that I did it. But I'm still pretty resentful that that's what it took for me to live a normal life. When I finally went back to my doctor at the beginning of this year, after deciding that the tranexamic acid was not good enough, I think around February, she immediately agreed to schedule the hysterectomy in May. Now we were back to dealing with insurance. From my understanding, every insurance company has a set of guidelines that determine whether or not they will consider something medically necessary and cover it. In my case, I was directed to a surprisingly clear document by a very kind customer service representative that stated what conditions had to be met for my insurance to cover a hysterectomy. For the insurance that I'd had at the time, the requirements for having a hysterectomy for abnormal uterine bleeding, which is why I was getting one, were as follows. Symptoms have been present for at least 6 months and interfere significantly with activities of daily living, ADLs. Appropriate testing has been done. In this case, they list pelvic ultrasound and endometrial sampling. One of the following conservative therapies has failed to control the bleeding. 3-month trial of hormonal therapy, including oral contraceptive pills or hormone impregnated intrauterine device, IUD, or endometrial ablation. As you can see, I clearly meet 2 out of 3 of these, and as for the other one, the one about the testing, it was pretty easy to go and get a pelvic ultrasound, as unpleasant as they are. I refused the endometrial sampling though, due to the fact that I have a history of extreme pain that is probably verging on medical trauma when it comes to forcing things through my cervix without anesthesia from my IUD insertions. To do an endometrial biopsy, they literally stick something up into your uterus and take a small chunk of your uterine tissue while you're still conscious. The goal of this is to determine if you have endometrial cancer or other abnormalities, as this would change the requirements for the surgery. People do report varying levels of pain and discomfort, just like with IUD insertions, with some saying that it was unpleasant but bearable or even no big deal at all, and then others saying that it was like medieval torture and the worst pain that they'd ever experienced. So make of that what you will. My doctor was comfortable with skipping this for me because she had actually done an endometrial biopsy while I was under anesthesia about a year and a half prior that showed no concerning tissue abnormalities, and she agreed that it would be unnecessarily traumatic for me. But at the end of the day, if the insurance had required it, I would have bit the bullet and done it. You can request pain management for this, including like one-off anxiety medications, just so you know. I think if you have enough time to schedule it, you could even request twilight anesthesia. Thankfully, my insurance company gave no pushback regarding the missing endometrial biopsy, even though my doctor was prepared to argue my case. I was really surprised, honestly, by how easily the insurance approved my procedure. I was a bit spooked from the last time I tried when I was a lot less informed about the process, and the denial at the time kind of felt like this insurmountable hurdle. Granted, I also switched insurance companies, so it might just be that my new one was more reasonable. But all that to say, insurance approval was completely not problematic for me this time, which was really encouraging. Even though I was only 25, there was no pushback. So with the insurance approval secured, I moved on to getting ready for surgery. In the weeks leading up to the surgery, there is another appointment with your doctor in which you sign what is essentially a waiver or consent form, in which you agree that you've been counseled on the risks and have a complete understanding of the procedure, and fill out other paperwork. They also confirm the surgery date and send you home with a special antibacterial soap that you use before the surgery, and it helps reduce the risk of infection, along with your other pre-surgery instructions. A week or so before the actual surgery date, I had a call with an anesthesia nurse who instructed me on what to do with regards to medications, vitamins, and other drugs in the week leading up to surgery. In my case, I was told to stop taking pretty much everything for a week beforehand, which for me was just vitamins. And we also talked about other typical surgery stuff like not eating after midnight the night before, and not drinking anything but water the morning of up to a few hours before your surgery. The day of, I took out all of my jewelry, did the antibacterial soap shower, and wore comfortable clothes to the hospital. My partner drove me there, and I was lucky enough to have a morning time, which is a good thing, because that way you get less hungry before your surgery starts. Everyone was very pleasant as always, and as I was being led back into the waiting area where they have you change and put in the IV, the nurse quietly said to me, "I'm so sorry to ask this, but is there any chance you could be pregnant?" And I was honestly taken aback and frankly just confused by her somber tone. It honestly didn't register at all for me that for some people having a uterus removed at the age of 25 isn't just cause for celebration. So I just answered no in a slightly bewildered tone since I had been sterilized previously. After changing, I got as cozy as possible in the hospital bed, and my partner was allowed to come back and join me while I waited. A nurse started an IV, and the anesthesiologist came by to explain what she was going to do during the surgery. The first nurse tried pretty hard to get me to use this anti-nausea patch that they recommend for young women in particular because they have the highest rate of post-anesthesia nausea apparently, but that's never been a problem for me at all, so I rejected it because it has several side effects that I did not want to experience. And I didn't end up having any nausea anyways, so it ended up being the right call. The moral of that story is listen to the medical professionals, of course, but also advocate for yourself if you have a gut feeling or you feel strongly about something. I was really not nervous at all, strangely. I had made my choice and I knew there wasn't really a viable alternative, so I just felt kind of at peace about the whole thing. The only thing that was a bit concerning was that they were running a bit behind because of a more complex surgery that was being done that morning. So mine started about 2 hours late. I only started getting nervous because I was worried that they'd fall so far behind that they wouldn't be able to do my surgery that day, which would have been kind of devastating. But thankfully, they did manage to do my surgery that day, and everything did feel a little bit rushed once they started wheeling me back. I didn't even get an anesthesia countdown, which is sad because that's like the only good part. The operating room was cold as usual, and they had me scoot from the bed to the surgery table and then confirm my name and the surgery that I was there for. At some point that I'm not aware of, they knocked me out, and just like that, I woke up in the recovery room. In total, the surgery was around 2 hours, which is the longest that I've ever been under anesthesia. I woke up feeling pretty terrible. Apparently, the medication that they were giving me was fentanyl, by the way, which wasn't really doing much for me for the very deep discomfort that I was feeling. I say discomfort rather than pain because it was more of an intense, deep, full body discomfort than any specific pain. I felt like what I would have imagined it would feel like to be hit by a truck. After I told her twice that I was still feeling terrible, she told me that she had given me the maximum amount of pain medication that she could. So from that point on, my pain level just stayed at like an 8 out of 10, which was highly unfortunate. I was given ice to suck on and apple juice, which were both pretty nice. No complaints there. Once I was more coherent, I was moved to the secondary location, which is the secondary recovery room, where they allowed my partner to rejoin me. There we got the recovery and medication rundown, and then I was allowed to put my own clothes back on. When my partner helped pull me up from the bed, I remember looking at him and saying, "This is the worst I've ever felt." And it was true. It's the worst I've ever felt on the whole, which is different than the most pain I've ever been in. That award goes either to the unmedicated IUD insertion or the time I had an ovarian cyst burst. I was groggy, my whole body ached, and my abdomen was so swollen. Honestly, I was a little bit shocked by how bad I felt, and I didn't feel ready to do anything, but the nurse seemed to really want me out of there. I've also heard that depending on what kind of hysterectomy you're having and what country you're in, they sometimes keep you in the hospital overnight or even for a few days. But since mine was on the minimal side and I'm an American, I was out of the hospital within a few hours of my surgery finishing. Before they let you leave, you have to prove that you can pee by peeing, which I could, thank God. And then they wheeled me around to the back where my partner had pulled up the car. Quick note on peeing. I think I have a catheter phobia, so I was really concerned about being conscious with a catheter, which I'm happy to inform you, I never was. They only used it during the surgery while I was anesthetized. The car ride honestly wasn't bad. I was still pretty out of it, and I don't remember much of it. It mostly felt kind of surreal, finally actually having no uterus after fighting for it for so long. I did start feeling better pretty quickly. I was able to walk up a flight of stairs pretty easily with a little bit of assistance and was fine also sitting at the table for a little bit and having a snack before getting into bed. Recovery. I didn't end up taking any of the stronger pain medicine that I was prescribed, which I'm pretty sure was oxycodone. I never even opened it. I just alternated ibuprofen and Tylenol at the recommended 6-hour intervals. The main things that were bothering me for the first few days were my very air-filled swollen abdomen and the air that traveled up into my shoulder. During a laparoscopic surgery, they actually will fill your abdominal cavity up with gas so that they can see in there, and it can be hard to remove it all. So some of it actually stays in your body and just gets slowly absorbed over the following days and weeks. It can be extremely uncomfortable, especially when you sit up and it moves up into your shoulders. So I alleviated that the best that I could with a heating pad and just laying down as much as possible. The pain medication didn't really seem to help with that at all, from what I could tell. The swollen abdomen lasted about a week, and after the first night, it was already a lot better. And after about a week and a half, everything looked and pretty much felt back to normal, other than the bandaged incisions. I had no problem sleeping pretty much completely normally from the very first night, and I was even able to sleep on my side right off the bat. Flipping over was a little bit uncomfortable because I was trying to not use my abdominal muscles, which made it a little bit of a challenge, but even that was manageable. Getting out of bed for the first few days was also a bit uncomfortable, and it was pretty helpful to have my partner there to help pull me up. but I would also guess that it would have been totally doable on my own if I had needed to. There were also those 2 times that I woke up early feeling incredibly hot that I mentioned earlier in the video. After a couple of days, I was able to do sort of slow laps around the inside of the house, and by 2 weeks, I felt largely back to normal aside from the occasional twinge in the pelvic abdominal area and some mild fatigue. And for those first 2 weeks, I definitely did quite a bit of napping. At my 2-week post-op check-in, my doctor informed me that the lifting and bending restrictions were mostly in place for people who had larger incisions, and that since I only have small incisions, I can get back to regular activity like stretching and bending, and also reasonable lifting whenever I felt up to it. I did wait to go on longer walks, probably until 3 or 4 weeks post-op, because I really did not want to overexert myself. You only have one opportunity to heal something right the first time, so I wanted to take care to make sure that I was giving my body the best chance that I could. I do feel like I lost some strength and muscle from taking it easy for so long, so it took a bit to rebuild some of my normal, strength. I also didn't drive for about 3 weeks. I don't remember what the official recommendation was, but that's how long I waited. There was some occasional very light bleeding that started around a week into recovery that lasted for about 2 weeks. It started pretty shortly after I had a bit of a laugh attack, so maybe try to avoid laughing really hard. My doctor assured me, though, that it was completely normal, so I didn't worry about it. By week 5, I was pretty much back to normal activity. For some reason, I was really, really motivated to go pick up a futon. This futon, in fact. And I went to go pick one up with the help of my brother, and I put it in the car and helped carry it up the stairs with no pain or issue. I'm not saying I recommend that. In fact, I'm actually going to recommend that you don't do that. But since my surgery and incision were so minimally invasive, there was really no harm to be done by those activities, but probably still don't do it. After the 6-week check-in, I was cleared for all normal activity, and by the time it was 2 months out, I was hardly even thinking about it anymore. I want to quickly shout out pelvic floor physical therapy. I had seen a pelvic floor physical therapist for a while pre-surgery to address my hypertonic pelvic floor, and I also had several visits post-surgery, which I found really helpful. It allowed me to check back in with all of those muscles and recalibrate everything with my new body. And it was also comforting to just have a medical professional who had had many patients who'd had hysterectomies tell me that things feel good, and she was also able to help me with some scar and abdominal massage. I really recommend trying it out or asking your doctor about it if that's something that is accessible to you. It's generally recommended to take 4 to 8 weeks off of work, depending how intense your surgery is and what you do for work. Some people say that they were able to return to at-home computer-based work after 2 weeks, and some said it took much longer for them to feel up to even the computer work. In my case, I would say that it took about 4 weeks for me to feel like I had the mental capacity to really focus on something, but I was able to browse YouTube and read pretty much right off the bat. Now, at 7 months later, I only really think about it in passing when I see my scars, or when I'm reminded of how exciting it is that I'm actually free from this tyrannical organ. The only thing that didn't exactly go to plan with my healing was that after 2 months, some of the stitches hadn't dissolved, even though the paperwork said that they should have been long gone by then. The sutures were made out of this dissolvable plastic material, and parts would just not dissolve. In 2 of the scars, I had these little plastic knots that wouldn't come out when I tugged on them. Don't worry, I did this with express permission from my doctor's office. I ended up going into the office, and my doctor dug them out with extremely pointy needle-like tweezers, which honestly hurt more than any of the pain that I'd had during recovery. She told me that that is something that was happening more often because either the insurance companies or the hospital had insisted they switch to a generic brand of the material over the name brand material. I was worried that this would lead to permanent divots in the scars, but she assured me that they would heal over evenly, and they did. Honestly, all in all, my recovery was pretty uneventful. I was still very careful, especially those first 4 weeks, and I was definitely pretty preoccupied with not doing anything that could mess things up, since I really, really did not want to do any damage that would cause long-term complications. I really did not want to create a new problem in the process of trying to solve a different one. I will say There is one negative change I've noticed since having the surgery. Randomly, about once every few weeks, in the mornings, typically before I've eaten anything, I get a very painful, sharp sensation in my lower abdominal intestinal area. It happens right around when I can feel my intestines sort of start to like wake up. And of course, there's no guarantee that this happened as a result of the surgery at all, especially since it didn't start until like 3 months after. But it seems possible that it's related, so I wanted to mention it. While it is definitely very uncomfortable, it is a price that I am more than willing to pay. And who knows, as things settle, it might go away anyways. The lab testing of my uterus didn't reveal anything about why I might have been experiencing such heavy bleeding and cramping. There was no endometriosis or adenomyosis, no fibroids, no nothing. So ultimately, that pretty much just leaves a bleeding disorder, but it's still a mystery to this day. Something else that I found extremely interesting that I wanted to share is that my uterus turned out to be 30 grams and 5 centimeters by 5 centimeters by 2.8 centimeters, which is just a lot smaller than I was expecting. This is on the small side for a healthy uterus, but I was so surprised that something so tiny could cause so much suffering. In the build-up to the surgery, I read and listened to a lot of different stories from people who had had hysterectomies. There were several things that I was worried about going into it that didn't end up being an issue at all, so I'll address a few of those things here. The first thing is brain fog. I had heard it mentioned a couple of times as something that people experience for weeks or months after their surgeries for unknown reasons. I don't think that my brain was especially foggy beyond the normal recovery fatigue. The next thing was this feeling of your insides like rearranging themselves that a lot of people talk about. I think the idea is that since your uterus isn't there anymore, your other organs kind of like move to fill the space in, but I didn't experience any of that. Finally, I read that some people have an emotional response to having their uterus removed, even if they never even wanted children. And let me tell you, I didn't experience anything even close to that for even 1 second. Additionally, there are a lot of lists. Especially on Reddit is where I saw a bunch of things that you can buy to aid in your recovery. Everything from like heating pads to special pillows to prop you up, certain foods, and some people even mentioned the like distance grabbers so that you don't have to bend over. I didn't need anything like the grabber myself, since my incisions were small and I could bend and squat easily, but it seems to be pretty handy for people who have larger incisions or more invasive surgeries. What I found is that I honestly didn't need anything special at all. I didn't buy anything really in the lead up to my surgery other than a few food treats, since I anticipated having a reduced appetite for a few days after, which I kind of did. So it was nice to just have something delicious around. I just used normal pillows that I already had to prop me up in bed, and I used a heating pad I also already had. I didn't really need anything else. Some people talk about an abdominal binder or even having been given one by their doctor, but in my case, I wasn't given one, and I also never felt like I needed one, which likely had to do with my smaller incisions and how minimal my surgery was. An abdominal binder, by the way, is basically like this corset-y thing that like you strap on and it kind of like keeps everything like together here. It sounds kind of nice, but not something that I had a need for. I did actually keep a small throw pillow nearby to kind of like press to my abdominal area when I'd sneeze or roll over in bed for the first few days, which helped things feel like a little bit more secure and supported since it all felt kind of swollen and weird and uncomfortable. There's no shame in wanting or needing those extra things. I just personally didn't end up having any need for those specialty items. Something to note is that people will sometimes suffer from constipation after anesthesia, and it's also a side effect of prescription pain medication, so it is recommended, especially if you're taking those, to eat high fiber foods, hydrate, and even keep a stool softener around just in case. Really quickly, I want to touch on cost. I can only speak as an American, I just don't really know how this works in other countries. So here we go. My insurance did cover the surgery, but I did still have to pay my deductible, which was like $3,500, which is by no means an insignificant amount of money. The out-of-pocket cost for the surgery would have been somewhere around $50,000, which is insane and ridiculous. Having a $3,500 deductible is actually also insane and ridiculous, but that's beside the point. However, the ease with which hysterectomy was covered with my second insurance makes me feel that as long as you have insurance, you can find a doctor willing to perform it and you're willing to jump through a few diagnostic hoops and you're able to pay your deductible, it should hopefully be attainable. Obviously, it should be attainable to anybody who wants one, but unfortunately we don't currently live in that world. I'm going to take another moment here to plug the child-free friendly doctors list again, linked in the description below. Seriously, go check it out. I know you want to. All things considered, having my uterus removed is the best decision that I've ever made. I'm grateful literally every day that I was lucky enough to have it done. The amount of freedom that I have now is unbelievable. I'm not bound to doctor's visits and pharmacies. I'm not at the mercy of insurance companies. I can plan vacation and pool days whenever I want. I can work, exercise, go out, do whatever I want, go wherever I want without being crippled by what was likely an unfortunate combination of a bleeding disorder and a uterus. I have so much more time and energy to focus on things that actually matter to me now. It's unbelievable. Menstruation can be a very real burden and threat to quality of life, even in the best case scenarios, and we need to be working harder to free people of its tyranny in ways that aren't detrimental to their health. Everyone deserves to live a life free of it if they want to, for any reason, and hormonal medication and ablation are not always adequate options. Hysterectomy is one of the best options we have right now, and I hope that more people who think it might be right for them will feel empowered to consider it for things such as ending menstruation, and not just for immediately life-threatening diseases or conditions. Yes, surgeries like hysterectomies have side effects and potential serious long-term consequences that even I may experience at some point. But so do living with pain and heavy menstrual bleeding and other female reproductive issues. When it came down to it, I was happier accepting the potential risks of the hysterectomy over living with the guaranteed suffering that menstruation was causing me. Not to mention, with all of the political strife happening in the United States of America and many other places across the world, with the threat to abortion rights and the obvious attempts to control women and people with the ability to get pregnant through legislating reproduction, I now feel the truest sense of freedom and autonomy that I've ever felt, and I cannot imagine going back to how I was before. Please feel free to let me know in the comments if you have any thoughts or questions, or if you yourself have had a hysterectomy and what that was like, or if you are planning on having one and for what reasons, if you are comfortable sharing. Once again, this video is not medical advice, and I am not a medical professional. I have just researched this a lot, and I think that we need to share more stories. Always talk to your own doctor and do your own research. This video is a compilation of everything I learned in my hysterectomy journey, and I just wanted to share it with people who it may be helpful to. Thank you so much for watching. Eat fruit, don't multiply, and I will see you in the next video.